Hello guys, as you know, 7th April is celebrated as World Health Day. This year, WHO, World Health Organization, decided the theme is depression. Let's talk. Before starting this topic, first you should know what is depression. हम यूजुअली दोस्तों को बोलते हैं मैं डिप्रेस्ड हूँ यार, वो डिप्रेस्ड है यार। आखिर क्या है ये डिप्रेशन? Depression can affect all age groups. It may be child, mother, old age, or adult. Everyone can. Because of depressions, आप अपने डेली टास्क भी नहीं कर सकते हैं. Or sometimes you can face family conflicts and even loss of jobs. At worst, depression can cause suicide. That is the second leading cause of death in 15 to 29 age group. लेकिन फिर भी यू डोंट वरी बिकॉज डिप्रेशन का बचाव भी है और उपचार भी. फॉर दैट वी शुड रिमूव स्टिग्मा इन द सोसाइटी. आखिर क्या है ये स्टिग्मा? क्यों है ये स्टिग्मा? अगर मैं को कहूँ मुझे मानसिक बीमारी है, लोग मुझे ढूंढने लगे. लेकिन मैं कहूँ मेरे पैर में फ्रैक्चर है, देन दे विल से लेट्स गो टू हॉस्पिटल. आखिर क्यों डिप्रेशन में हॉस्पिटल नहीं जाना? This stigma should remove from the society. Who will take this challenge? आप, मैं और हम सब. चलो, let's talk about the depression. Definition of depression. Depression is an illness characterized by persistent sadness and loss of interest in activities that you normally enjoy, accompanied by an inability to carry out daily activities for at least 2 weeks. These symptoms should sustain for minimum 2 weeks. About depression. More than 300 million people are suffering from depression. Depression plays a major role in overall global burden of disease. Depression is more in the woman than the man because women are more sensible and emotional. लेकिन what is the good things in that? Because depression can be treatable. Now let's talk about depression. आखिर क्या करना है हमें डिप्रेशन में? How we can help to ourselves, family and society. That someone is suffered from depression. Always remember, depression is something that can be happen to anybody. In that time, you should talk to someone which you trust about your feelings. Most people feel better after talking to someone who cares about them. Their nearest one. Seek professional help. Your local health care providers or a psychiatrist is a good place to start. Remember that with the right help, you can get better treatment. Keep up with the activities that you used to enjoy when you were well. It means going to college, going to your jobs. Stay connected. Keep in contact with family and friends because family and friends are well ventilators. Exercise regularly even if it's just a short walk. Minimum exercise can be helpful. Stick to regular eating and sleeping habits. Same time you should accept that you might have depression and adjust your expectations. Make a short goal and accomplish that to win the confidence. Avoid or restrict alcohol intake or other drug substances because they can worsen the depression. In that duration, if you will feel suicidal, contact someone for help immediately. Don't feel shame. Talk to someone, ventilate your feelings. Now question is, do you feel like life is not worth living? Always mind it. You are not alone. Help is available. What you might be thinking or feeling. The pain seems overwhelming or unbearable. You feel hopeless, like there is no point in living. You are consumed by negative and disturbing thoughts. You cannot imagine any solution to your problems other than suicide. Now you will think death is a relief. Then you can also think everyone will be better off without you. Worthless feeling can come. You feel very lonely even when you have friends and family. You do not understand why you are feeling or thinking this way. In these feelings, what you need to remember, you are not alone. Many other people have gone through what you are going through and are alive today. It is okay to talk about suicide. It can help you feel better. Having an episode of self harm or suicide thoughts or plan is a sign of severe emotional distress. Perhaps as a result of loss of loved one. It may be loss of employment, a relationship breakup, or experience of violence or abuse. You are not supposed to blame, and it can happen to anyone. You can get better treatments. There are people who can help you. Now, what you can do, talk to a trusted family member, friends, colleagues about how you feel, what is your internal feelings. If you think you are in immediate danger of harming yourself, contact the emergency service provider or a crisis line or go there directly. Talk to a professional such as psychiatrist, mental health professionals, psychiatric nurses, counselors, and psychiatric social work. If you practice a religion, talk to someone from your religious community who you trust. Join as a self-help or support group for people with lived experience of self-harm, and you can help each other to feel better. That's all. Right. Now question arises. Do you know someone who may be considering suicide? What is your therapeutic approach? You should talk to them about suicide. Listen with an open mind and after your support. What you should know if you are worried about someone. Suicides are preventable. It's okay to talk about suicide. Don't be hesitate. Go and talk with the person. Asking about suicide does not provoke the act of suicide. It's often reduce the anxiety and help people feel understood. Warning signs of suicide. Person will try to threaten to kill oneself, saying things like, "No one will miss me when I am gone." Person will looking for the ways to kill oneself, such as seeking access to pesticides, firearms, or medications, or browsing the internet for mean of taking one's own life. Saying goodbye to close family members and friends, giving away of valued possessions, or writing a will. These are the warning signs. Who is at risk of suicide? People who have previously tried to take their own life. Someone with depression or an alcohol or drug problem are more prone. Those who are suffering from severe emotional distress, for example, following the loss of loved one or a relationship breakup. People suffering from chronic pain or illness are on high risk. The people who have experienced war, violence, trauma, abuse, or discriminations. Those who are socially isolated. These are the group who are more at risk of suicide. Now, how you can help? We should find an appropriate time and quiet place to talk about suicide with the person you are worried about. Let them know that you are there to listen. Encourage the person to seek help from a professional. Offer to accompany them to an appointment. If you think the person is in immediate danger, do not leave him or her alone. Seek professional help from the emergency services, a crisis line, or a healthcare professionals, or turn to family members. If the person you are worried about lives with you, ensure that he or she does not have access to means of self-harm. In the way, she should not reach to pesticides, firearms, and medication in the home. Always stay in the touch to check how the person is doing. By this way, we can prevent the person to do the suicide. Now we'll talk about very sensible age group, teens and adolescent, as you are on high risk. Adolescent and young adulthood present many opportunities because they are for meeting the new people, visiting new places, and finding a directions in life. These years can also be a time of stress. If you are feeling overwhelmed rather than excited by these challenges, if you are going to fulfill the dreams, then you should be excited. You should not be overburdened. In that condition, you should always remember there is a lot that you can do to keep mentally strong. If you feel that you may be heading for depression, talk to someone you trust or seek professional help. It means meet the psychiatric mental health professionals. What you can do if you are feeling down or thinking you may be depressed. In that time, talk to someone you trust about your feelings. Ventilate your feelings with your friends and colleagues. Seek professional help. Stay connected. Keep in contact with the family and friends. Exercise regularly, even if just a short walk. Maintain a regular eating and sleeping habits. Avoid or restrict alcohol intake and refrain from using illicit drugs because they can worsen the depression. Continue doing things you have always enjoyed, even when you don't feel like it. Be aware of persistent negative thoughts and self criticism and try to replace them with the positive thoughts. Always remember, congratulate yourself on your achievement. Achievement may be small or big, but every achievement should be congratulated and appreciated. Now, depression in motherhood. Wondering why your new baby is not making you happy. Even having a baby is major life event and can cause worry, tiredness and sadness. Usually these feelings don't last long, but if they persist, you may be suffering from depression. In that condition, you should always remember depression after childbirth is very common. If you think you may be affected, then go and seek help. What you should know about that? Depression following childbirth is very common. It affects 1 in 6 women who have given birth. Symptoms of depression after childbirth also include a feeling of being overwhelmed, means extra work, persistent crying for no apparent reason, lack of bonding with your baby, and doubt about being able to care for yourself and your baby. Depression after childbirth can be treated with professional help. Talking treatments and medicines can help. Some medicines can be taken safely while breastfeeding because while the breastfeed they can affect the child development. Without treatment, depression following childbirth can last for months or even years. It can affect your health as well as development of your baby. So, what you can do if you think you have depression? Discuss your feeling with person close to you and ask them for support. It may be husband, your parents, your in-laws. They might be able to help you look after the baby when you need some time to yourself or to rest. Always stay connected by spending time with friends and family members because feelings should be ventilated. Get out in the open air when you can in safe environment. Taking your baby for walk is good for both of you. Baby will be healthy and your feeling also will be ventilated. Talk with other mothers who may have advice or be able to share their experiences. Talk to your healthcare provider. He or she can help you find the treatment that is most appropriate to your situation. If you have thoughts of harming yourself or your baby, seek help immediately because these are the major symptoms of depression. Worried that your child is depressed. In childhood, growing up is full of challenge and opportunity. Starting and changing the schools, making new friends, going through puberty and preparing for exams. These are the stress factors. Some children take change in their strides. For others, adaptation is harder. That causes stress and even sometimes depression. If you think Your child might be depressed. Talk to him or her about any worries or concern and seek professional help as soon as possible if there is a need. There are some signs and symptoms of depression during childhood. These are withdrawal from others, irritability in the school timings, excessive crying, difficulty concentrating at school, again and again complaint from school, a change in appetite or sleeping more or less. Younger children may lose interest in play, and older children may take risks that they would not normally take. If this condition has arisen, what you can do? You should talk to him or her about things happening at home, at schools and outside the schools. Try to find out whether anything is bothering him or her. Ventilate the feelings of child. Talk to people you trust who know your child. They may be child friends, parents of child friends. Seek advice from your healthcare provider. Protect your child from excessive stress, maltreatment, and violence. Pay particular attention to your child well-being during life changes, such as starting a new school or puberty. Your child should be properly attended. Encourage your child to get enough sleep, eat regularly, and be physically active, and to do things that he or she enjoy. Make time to spend with your child. You should know your child. If your child has thoughts of harming him or herself or has already done so, seek help from a trained professional immediately because that can lead to the worst end of suicide. Now we'll talk about old age or gold age. Staying positive and preventing depression as you get older. The life changes that come with aging can lead to depression. Always remember there is a lot that can be done to prevent and to treat depression in old age. Depression is common in older people but often overlooked and untreated. Depression among older people is often associated with physical conditions such as heart disease, high blood pressure, diabetes, difficult life events such as losing a partner, and a reduced ability to do things that were possible when younger. Older people are at high risk for suicide. Depression is treatable with talking therapy, antidepressant, medication, or combination of these. What you can do if you are feeling depressed or down, talk to someone you trust or ventilate your feelings. If you think you are feeling depressed, take a professional help. Keep up with the activities that have always enjoyed, or find out alternatives if previous activities are no longer possible. Stay connected with the family and friends. Eat a regular interval and get enough sleep. Less quantity, more time food should be taken. Exercise regularly if you can, even if it's just a short walk. Avoid or restrict alcohol intake or only take medication as provided by your healthcare provider. There are several forms of depression: major depression, dysthymia, minor depression. Minor depression divided as psychotic depression, postpartum depression, seasonal affective disorder. And fourth point is bipolar disorder. Signs and symptoms of depression: persistent sadness, anxious and empty feelings. There may be hopelessness or pessimism, worthlessness feelings, guilt, hopelessness, irritability, restlessness. Person will not feel interest in the activities that activity he was enjoying previous. Person will feel fatigue and decreased energy. Person will not concentrating on the things which he want to concentrate. Remembering the details, memory loss, making decisions. Patient will feel insomnia, early morning weaknesses, and excessive sleeping. Overeating or appetite loss can happen. Thoughts of suicide and suicidal attempts can be done by the person. Aches or pain, headaches, cramps, digestive problems that did not ease even with the treatment. These are the basic symptoms of depression. What illness often coexist with the depression? Post-traumatic stress disorder, PTSD we can call, obsessive compulsive disorder, panic disorder, social phobia, GAD, generalized anxiety disorder. Depression also may occur with other serious medical illness such as heart disease, stroke, cancer, HIV/AIDS, diabetes, and Parkinson's disease. These disease conditions can be associated with the depression. Thanks for kind attention. And always remember, take a challenge. आप, मैं और हम सब create awareness about psychiatric disease, remove stigmatization, and choose institutionalization. Thanks again.